A couple days back, I went to a nursery near me to pick up some pansies, which they're a cold tolerant plant and are perfect for this time of year, but even for them, it's a little bit early, but I was thrilled to find them. They're one of my probably top 5 favorite flowers. Anyway, while I was there, I popped into the greenhouse and lo and behold, they had what I think is my all-time favorite herb taste-wise. And after today, I think you'll agree it is a terrific herb from a protective perspective when it comes to cancer. Hi, my name is Mary Johnson. I'm a registered dietitian and owner of Healing Food for Cancer. And in today's video, we're going to talk about basil and why it's something that you should grow this summer in your garden. Now, I will say right off the bat, it is very early for basil. Unlike the pansies I bought, basil does not like the cold. Basil loves the sun and it loves plenty of water, and I'm going to be babying this little plant along until the weather warms up. I'm only taking it outside on really unusually warm, sunny days. I've got it in a bright room here in my house, and it may or may not make it, but it was worth it to me to buy it because I will be using it so much over the coming weeks as I prepare different dishes that I enjoy. So what is it about basil that makes it such a terrific powerhouse of an herb when it comes to cancer? First off, basil is vitamin rich. It's protective for cells during radiation. It also is a terrific herb to use if you're experiencing taste changes during treatment. And I'll drop a link to a video that I did about taste changes below so that you can learn a little bit more about using it and when you might want to use it if you're experiencing taste changes. It's also terrific for mouth and throat irritation, depending upon the kind of treatment that you're having. And it also aids in digestion. It's antibacterial, anti-inflammatory, and rich in antioxidants, and it is also supportive of the liver, brain, and heart. The other thing that it does, which is really kind of amazing, is it contains nuclear factor KB or NFKB, which is a transcription factor. And it turns genes, or gene expression I should say, on and off. And that plays an important role in a variety of different processes, including cell growth, development, and survival, as well as immune response and inflammation. Abnormal NFKB activity can contribute to the development of cancerous tumors. So let's talk a little bit about the taste and when you might use it. Basil has kind of a pungent flavor, sweet pungent flavor that most everyone loves. If you have ever enjoyed pesto in a dish, pesto is made with many different types of plants, but basil is probably the most common thing that is used in pesto. It is very popular in a lot of Italian dishes, so in, for instance, tomato sauce, tomato soup. I've seen different types of fruit salad where pesto is an ingredient, so it's a very versatile herb. I'll mention again that this is really, really early to get a basil plant. Basil prefers plenty of sun, and it really thrives in hot, sunny days and hot, sunny climates. When it comes to picking it, I recommend picking it right before you're going to use it. If you should get basil, maybe purchase it at the store and it's already been picked, you can put it in a vase of water, put the stems in a vase of water just like you would a flower to help to preserve it, and it will last quite a while that way. It is a very tender leaf, and so without some support like that, it will wilt. And it is a little bit more, it's probably one of the more tender herbs that are out there. As always, these videos are not intended to be a substitute for one-on-one individualized care. I urge you to reach out and work with your care team to make sure that any foods that you're consuming are part of a plan that is appropriate for you. If you'd like to learn more about working with me one-on-one, you can reach me through my website at healingfoodforcancer.com. Thanks so much for watching, and I look forward to seeing you in the next video. Bye-bye.